everyone. Thank you for tuning in tonight. And today we are very honored to have Dr. Chen Yiming with us, really thankful that he is willing to take time off his busy schedule to just do some sharing with us, right? And it's also his first time doing a Facebook Live. Yeah, everyone has first, so it'll be a good experience. Okay, so Dr. Chen is co-founder and medical director of Vitacarefamily Group of Singapore, and also deputy medical director of CSK Aesthetics Group. And he also has a health and fitness website. It's called fitivate.com. And they provide free contents and training with regards to health and fitness. And he also claims that he's a YouTube wannabe.
In a way.
And he has a channel. It's called Doctor Wellness. So along the way, I think you will be uploading useful information there as well, right?
Yeah. Whenever when I have time.
Whenever
to produce more videos.
Yeah, correct. So yes, thank you so much for coming to our show today. Maybe you want to tell us a bit more about yourself other than what I've mentioned. You are dad to 2 kids.
I'm a dad to 2 kids. So they're 4 and 2.5.
Okay.
So I think my wife is somewhere inside watching. Priscilla.
Okay. Somewhere inside. Hi, Mrs. Chen, Priscilla.
So in fact, I just finished work and rushed back to my parents' place to do this Zoom, Facebook Live.
Yeah. So is it very far away?
It's pretty close to my house. So it's quite okay. It takes a short while to get home.
Okay. So you are actually a GP at Punggol Central, is it?
Yes. So our group, the Vitacarefamily, we have 4 clinics, of which I practice in Punggol Central branch. Half my time I'm also at Heartland Mall, this CSK Aesthetics in Heartland Mall. So that's my second line. In terms of clinical work.
So where are you mostly actually?
Actually, it's half, so quite even.
Okay.
Yeah.
So do you see a lot of kids on a daily basis at Punggol? I believe you do, right?
In Punggol, yes, very much. Almost 30-40% of my patients are young children. 10, quite a lot.
Okay. So so today actually we'll be discussing on this issue about like fever and choking as well as allergies. The reason why I chose these 3 topics, it was actually chosen by me. I mean, like, it's a personal interest in the topic itself. Because I think that although circuit breaker is over, but we are actually home most of the time because we can't really travel much yet. I just wanted to provide more information on like maybe how we can self-manage emergencies, or how can we discern whether this particular thing that is happening to my child, whether it is an emergency or whether it is not an emergency. So I think a lot of times, healthcare workers, they actually have some complaints that, like certain things we don't have to go to KK, for example, the A&E. Anxious parents like us are actually overcrowding the space in KK. And so I just wanted to touch a very sensitive point?
No, not really. I think if the KK doctors were here, they will agree with what you were saying. Not so much us, but the KK doctors. Yes.
Okay. So so I was talking about that, and then I lost my thoughts. So basically,
I saw Eileen's name.
Oh, hi, Eileen. Oh, yeah, she's here to show support. Thanks for linking up. So I just wanted to find out, like, under what circumstances, let's say if we are talking about fever, what are the signs we should look for before we decide whether we want to send our children to the A&E?
Yeah. So actually fever is very, very, very common. Is one of the most common presentation for children actually.
Yeah.
A lot of time, most of it is a viral infection. Or in fact, as much as 70-80% is viral infection. And most of them actually recover on their own. So it is true. A lot of the A&E doctors are sometimes they're a bit disgruntled because a lot of visits may not actually be necessary.
Yeah.
So in terms of fever, right, I usually divide it into 4 big groups. At least to make it easier for the parents to be able to identify which main group that the child actually belongs to. So the most common type is the fever with your flu symptoms. Your cough, your runny nose, your sore throat, yeah? So again, a huge proportion are viral infection and they tend to recover by themselves.
Okay.
Why you need to send to the hospital is most of the time, if the fever is too long, for example, if they've been coughing, having fever, it's more than 5 days, 6 days. Or if the fever is very, very high, like 39, 40, you sponge them, you give them medication, and it doesn't go down, just keep going up. These are the cases where you need to bring to the hospital or bring to your nearest family clinic if it's still open. Yeah. And of course, those child who are like breathless, when they breathe, you can actually hear very strange, weird breathing sounds. So these are the cases that you should also be very careful.
So is that what people call wheezing?
Wheezing, yes. The medical term can be called rhonchi, wheezing, bronchospasm, noisy breathing, we call it. Just when the breathing is extraordinary, it's not what you usually hear. So these are the things you should be careful about. The second cluster would be your fever with diarrhea, vomiting. Or the 肚子痛啊，泻肚子, okay? These cases also, most of the time, they are self-limiting. It recovers by themselves. Again, we have to be careful if it affects their feeding. If they are persistently vomiting, you give them a bottle of water, you give them a cup of water, they cannot take the water down. You give them half an hour later, they will vomit out. And if this persists for the next 6 to 12 hours, for a small young infant, it can already lead to early dehydration. So you got to be careful. Or if the diarrhea is, you actually see bloody diarrhea. Yeah, so this group also, you've got to be careful.
So bloody diarrhea is red or black?
That's a good question. Bloody diarrhea usually means the blood is mixed into the stool. So in the Pampers or in the toilet bowl, you actually see blood streaks. Okay, that is actually bloody diarrhea, usually from the large intestine. Okay, rarely you have very black stool. Or very black stool may mean that the blood has already been metabolized and it comes out as black. So this may indicate a bleeding somewhere higher up in the digestive tract, like the stomach, small intestine. So when the blood flows through the digestive tract, it gets metabolized. It doesn't look red anymore. It looks black. This is also an emergency if you do see it.
But if like certain children, right, their stools are like super black kind, but it's not like streaks, for example. I mean, when I was young, right, I used to have black. Stools that were black, basically. Like very hard and very black. I mean, now no longer, but yeah, when I was younger, I would constipate for some time.
I think if you're constipated and your stool is always like that, and if your child has a stool that's always like that, you will know this is normal bowel habit. So if it's something that is away from his usual habit, then you know it's not quite right. Then this black is something new. So this is a new event. But if it's always black and hard and it continues to be black and hard, then it's okay lah.
Can. Yeah, so you were mentioning there are two other
categories. So the third category is your fever with rash. Or fever with rash is actually more interesting. To me, it's more interesting than your cough, flu, and your diarrhea, because it allows us to think what are the possibilities, right? So fever with rash, you can have like your handful mouth, right? Fever with rash and then a lot of mouth ulcers. You can have your chicken pox. You can have your measles, although measles is not so common with our vaccination. Yeah, and then you can have a little bit, not those uncommon cases like your Kawasaki disease, meningitis. All these can have fever with rash as well. So fever with rash can be very, very mild, or it can be very serious. Like things like meningitis, Kawasaki disease. These are actually cases that you have to go straight to the hospital immediately.
Yeah.
So fever and rash is not so straightforward. So it's more interesting.
Okay.
To us, at least to me. To the parents, it may be very distressing.
Of course lah. So, but to you, it's maybe like a challenge. Like, okay, so now I need to like try to diagnose what is the situation.
Correct. Not as common. So this is something that tickles our mind a little bit. Then the very last group is the fever without any signs and symptoms. So it's just fever. There's no cough, no flu, nothing, no rash. This group, not a lot, but we do see, is also a challenge because sometimes you don't really know what's happening. All right. So there's a fever going on, but you need to find out what's happening. So more tests may be necessary to evaluate the fever. Like one thing that we often do in the clinic is to check the urine. Yeah. So urine infection can present as a fever with no symptoms, because as a young child, they cannot tell you that the urine is painful.
Yeah.
I see a question. Are we supposed to answer?
Yes, I will head to the question after we finish discussing this fever part.
Sure. So I'll leave it to you, huh? I don't want to
sure. No problem. So I was just saying, my son recently actually just had this UTI episode of UTI, urinary tract infection. So he had like mild fever for maybe like 5 days. So we thought like, on and off, I don't know what's happening. But then it seems it seems like maybe like hitty, that kind of, And then on the 6th day, it actually peaked to like 39 plus to 40. Yeah, then it turned out to be UTI. But I think by then it was already very, it was already quite bad.
Quite severe lah, huh?
Yes, I think the UTI was quite severe already. So we had to go to KKH.
I guess he got admitted, right?
We chose not to actually.
Okay, that's fine.
Yeah. So they actually said that they will encourage him to be admitted because he was quite young then. I think he was about 4 or 6 months. Yeah, so they wanted him to
6 months only,
I think so Yeah.
Okay.
Yeah.
So you're very brave, not to admit him.
Why? I mean, they say that if we don't admit, then it will be sort of like our responsibility lah. Right. Yeah. So my husband didn't want to admit, but so we had to monitor him for the next 24 hours. But he didn't present the symptoms that they told us to monitor for. So just sharing my experience. So anything you'd like to add on with regards to the fever part?
Okay. Well, I think a lot of parents, they opt to self-monitor. I think that's actually a valid practice.
Okay.
Yeah, it is because you know your child best. So if other things to look out for, if the appetite is really poor, or if your child is very, very lethargic, very, very drowsy, then you know something is wrong. Or if the child is less than 6 months old. That's why I say you're quite brave lah. So usually for fever and less than 6 months old, because the child's immunity less than 6 months old is pretty not very mature at that moment. So their immune system is low. So a lot of atypical infections can happen. Yeah, like infection that goes to the brain, a meningitis. You can have abdominal infections, which sometimes can be quite serious.
Yeah.
So children less than 6 months old with fever that is prolonged without a known cause, we also concerned, and that's one of the reasons why sometimes I refer to KK as well.
Yeah.
So these are the things.
I agree lah. But then when it comes to the hospital
I think,
stay,
yeah, like I say, the parent know the child best. So whenever when I discuss with my patients' parents, right, I always choose to respect their decision because they will never harm their own kid. So they can monitor. Why not?
Okay. Yeah. Okay. So yeah, we have a question. Okay, actually there's one question before that. It's by Kevin. Kevin asks, any recommendation what we can get for a home first aid kit for babies?
First aid kit for babies. Okay, there are not many things that you can prepare first aid kit for baby.
Okay.
Because your baby is not going to be, I mean, if you're talking about a 6-month-old baby, it's probably not going to be traveling very far. They probably won't be touching a lot of things. Probably they will still be under your close monitoring. So in terms of first aid kit, usually adults first aid kit, you have your bandage, your gauze, your alcohol swab, things like that, which you don't really need for the baby. So in terms of first aid kit for kids, I can't think of much.
Anyway, babies can't really take much medications, right? So
yeah, exactly. So in terms of, I mean, if you're talking about first aid kit, instead of first aid kit, you can talk about some first aid medication which you can store at home that you can easily reach for. For example, like a paracetamol. Yeah, paracetamol can be taken by infants.
Yeah.
Or sometimes a little bit of runny nose sensitive medications. After 6 months of age, there are some medications which is also can be given for infants 6 months and above. Yeah, so these are the standby, I would say, first aid medications that you can store lah. Paracetamol, things like your Telfast, Zyrtec, this stuff can be stored.
Okay, and nose drip? Is there a nose drip?
Yeah, there's nose drip. There's actually saline nose drip. There's Allergy nose drip. So these are helpful for reducing the blockage because as a young child, the nose is it's a very small cavity.
Yeah.
Yeah, and the organs inside can be very big in relative to the size of the cavity.
Okay, yeah. Makes sense. Okay, Ken, I hope we answered your question, Kevin. Okay, and we have Yvonne. Yvonne asks, hello, Dr. Chen. May I know for nose bag drip that cause coughing? My child has been taking Zyrtec and Nasonex for the past 2 months. Seen a PD twice, not recovered. What's your recommendation?
I cannot supersede PD's advice lah. But how old is your child, Yvonne?
Is she your friend?
Yeah, no, I don't. I guess if he's on Nasonex, it should be more than 5 years old lah.
Oh, is it? Okay.
Most of the time.
Okay. So
anyway,
we'll let her.
I'll just give a general answer.
Okay.
Allergic rhinitis is a very, very common condition. Very common. I can just based on my own database of children.
Wait, she replied.
Oh, 4 years. Okay, 4 years. But there are 4 or 5 can start already next. Okay. Allergic rhinitis is very common. Allergic conditions, in fact, in our children population is as high as 30 to 40%. Very, very high. Allergic rhinitis, eczema, asthma, allergic conjunctivitis are all very common. So you can't really prevent them. You can only manage them. There are mild cases and severe cases.
Okay.
So in terms of Yvonne's question, right, I always tell my parents, they may be coughing, right? But if they are playing well, eating well, growing up well, with allergic symptoms, right, you may have to accept that they may be coughing from time to time, but the cough is not going to hurt them.
Okay.
Yeah. So compared to giving them medications all the time to try to control that little bit of cough, I may explain and advise patients or parents to accept that bit of cough and let them grow up naturally without all the medications. That is my take. There's no right and wrong lah. Yeah.
Okay. So
but
basically,
in terms of medication, Nasonex plus Zyrtec is about as much as you can give. Sometimes we add on this medication called Singulair, Montelukast, but that one is in extreme conditions.
Okay, so basically, if your child has an allergic symptom, what do you call?
Allergic.
Yeah, allergic symptom.
We call them allergic child.
Okay.
Yeah.
Okay.
Like allergic
mine.
child.
Mine is an allergic child. So
you can have one or more of sensitive eye, sensitive nose, sensitive airway, sensitive skin. 4. You could have any combination of this 4, or just one.
Okay. Yeah. So the only way is to manage it, and hopefully, when they grow older, they will just outgrow this whole.
The simple statistics that I tell my parents also: 70% of allergic child by 7 years old tend to outgrow.
Okay.
For the rest who still have allergic symptoms by primary, early P4, 5, 6 and secondary school, chances are it may stay till adulthood, 20-30%.
Yeah. So for example, me lah.
I also.
Is it? So
sensitive nose.
Yeah, if I touch a certain thing and then I touch my nose, right, it will trigger, and then I'll just have it for like 2 days, the next 2 days.
Especially dust.
Yeah, correct. But only certain kind of dust, I realize. Like whenever I'm in a certain area, like my mom's place, she has this dust from this industrial area. So that's where it will trigger. But at my own place, even if it's a bit dusty, sometimes it may or may not trigger. Yeah, so I think
it may be the component inside the dust.
So do we, is it necessary to do a allergen test for this, just to find out? But you can't prevent, right?
This is a $1 million question, I think.
Okay. So do I get $1 million?
You can do. There is nothing wrong with doing. But I always tell, again, it's from a practical point of view, I tell my parents, like, you do already, you're allergic to dust. What can you do?
Nothing.
Dust is everywhere. So because when you go and do all this dust, usually it's the skin prick test that they do.
Yeah.
It's not cheap. You see the specialist, you do the skin prick test, it's not cheap, it comes out. But occasionally there are some stuff that comes out positive which you can prevent. Some metal, some types of food. Later we'll come to the food allergy. Some type of food which you can avoid. I think those are helpful.
Okay.
It depends on the severity of the allergic symptoms.
Okay. Yeah, so we have somebody here. Benjamin mentions that when he always go back to reservist, he will have rashes all over. Yeah, so he's grown up already. He's gonna stay. The allergy is gonna stay with him, right?
I think this one, good luck. Wait for MR.
Benjamin, you heard that? Okay, so we have a question from Mayan also. Teresa, will infants be able to outgrow dry, sensitive skin with frequent rash outbreak?
I think you're talking about eczema lah. I think her question is about eczema. So same thing that I talk about. Eczema, again, most time, 50-60% of the child tend to outgrow eczema by the time they're in primary school. Right? So, but we can't predict who will recover and who doesn't.
Yeah.
Okay, but sometimes you have an idea. If the eczema is very extensive, very severe, they tend to be prolonged and it goes into adulthood. Those mild cases usually goes away.
So
that's one indication.
So you're saying that those who have like maybe all over their body, they tend
they are very severe eczema cases, and we grade them based on the percentage body surface area affected.
Okay,
so like the 5 to 10% mild cases, they tend to outgrow it. The more than 10%, more than 20%, 30% are the severe cases. They tend to stay, unfortunately. These are the very, very allergic cases. They probably need to be managed by the specialists in the hospital.
Okay. So they tend to usually have like dry, patchy skin all over.
Yes.
Okay.
And then the skin is very red. You can have skin flakes coming off all the time. Quite distressing.
Yeah. But all these skin allergies, is it always that they have a trigger? Like either a food trigger or environmental trigger?
Okay. If you're talking about in children, the most common is what we call atopic dermatitis.
Yeah.
It is a very big word. Atopic basically means we don't know why. Okay. So there's no reason. So from inside, this is an allergic person, and there are triggers. Triggers can include dirt, sweat, dust, heat.
Okay.
So these are the triggers. There's a small proportion of very severe allergy very severe eczema that is due to food allergy. Okay, less than 5%. The food allergies that cause eczemas, the eczemas tend to be very bad. Tends to be very bad. So for severe eczemas, we don't send all child with eczema for allergy tests. But those very, very severe, the allergies tend to send for skin prick to exclude food allergy.
Okay.
You get what I'm saying?
Understand.
So food allergy is one of the cause of severe eczema. Okay.
So yeah, I hope we answered Mei Yan's question. Because I do notice that a lot of them, when they are breastfeeding, they actually do the elimination diet so that the food that they consume doesn't pass to their friend, to their child.
Yes, that is usually the first occurrence or onset of food allergy. In fact, sometimes.
Okay. Can. So we also have another question. How do you deal with toddler with constipation? Given enough water, fruits, prune juice, papaya, vegetables, still have constipation?
Okay, I can give you a case study. I actually have a patient. He's about 4 to 5 years old. His constipation is so bad that he requires admission sometimes to clear his bowel. It can be very, very bad. So this is a real problem, and it can be a very serious problem. Okay, if the constipation happens in a very young child, like an infant, we have to think about other causes. For example, there are some inborn conditions called Hirschsprung disease, where the colon is unnaturally still. They don't move a lot.
Okay.
So without moving a lot, you can't pass a lot. But that's for a very young, like infant age group. In the slightly older child, most of the time is habitual. Most of the time. I have seen personally a few cases of hypothyroid. Thyroid conditions where the thyroid hormones is a bit low. So their intestines a bit slow. Okay. So to answer Alex's question, adequate hydration is good. Adequate fiber is good. I think the other thing you have to make sure is adequate activity.
Yeah.
Okay. When the child moves more, your bowel will move more. All right. And if you have done everything and still the constipation is bad, then the next step is to see a doctor. Sometimes they really need a bit of help using medications. Okay, there are options available.
Yeah.
Okay, so, but again, not all constipation is a problem.
Okay.
Sometimes your child passes motion once every 2 to 3 days, and this is his normal habit, and is well and happy and running around, not complaining. It's fine.
Okay. But my doctor is like 4 days. 4 days once? 4 days, or maybe 5 days sometimes.
5 days is stretching it lah.
But I have this issue also lah. So I'm thinking if like I sort of like pass it on to her. Yeah.
Okay, I'm not sure if there is a genetical link to this.
Okay.
This one I'm not sure, right?
Okay.
I'm not sure. Can't comment.
Okay.
Yeah.
So so basically we try not to exceed 5 days. If not, otherwise we'll give like lactulose. Is it lactulose?
Yes.
Yeah.
Yes. Lactulose, yes. Lactulose is safe.
It's safe, but would there be an over dependency?
I think the parents can manage it. Because if you see, it's a vicious cycle, you see. If you allow the stool to become too hard, it gets impacted, right? Then it becomes even harder for the child to pass.
Yeah.
And if your kid is scared of passing, right, it becomes a psychological issue. If he doesn't like to go and pass, then the constipation gets worse. Okay. So a lot of factors come into play.
Okay.
Not straightforward, I would say.
Okay.
Constipation is a tough topic. It's a big topic.
Okay. Can. It's also my topic. Yeah. She always.
It's not easy.
Yeah. So I have to like record her pooping journal in my calendar.
You may want to record the size, the consistency as well. Sometimes there's a pattern to it.
Yeah. So when she like constipates a bit more, it tends to be like the fishball shape.
Yeah, the pellets.
Yeah. Then if it's like every 2 or 3 days, then she tends to have the normal shape. I don't know what you call that.
Yes, normal stool, well-formed stool.
Yeah, correct. Okay. Teresa just now she asked about sensitive skin, right? She has another question. How do we manage oily, smelly scalp in infants? Do they outgrow it?
Yes, definitely. Oily, smelly scalp. I think you're talking about seborrheic dermatitis. It is a greasy condition of the scalp. Again, it varies from child to child. Some infants don't have. Some infants can be so bad that the oily flakes cover the entire scalp. Okay. Or we call this the cradle cap syndrome.
Yeah.
It depends on how bad it is. Sometimes you can just leave it alone. After 6-8 months, it recovers. Okay. In the very, very severe cases, some of the common remedies that you can use is olive oil, right? So you apply olive oil on the scalp, you spread it out and soak it a little bit, then gently wipe off with a basin of water. You slowly wipe it off, it will come off nicely. Yeah, it's not a big problem. They outgrow it 100%.
Okay. Ken? Okay, Teresa. Don't worry, they will outgrow. Okay, then Alex mentioned that they have seen PD, taken X-ray, ultrasound, right. Okay, but continues to take Dufolac.
Yeah, so a lot of times that's what they do ultrasound, X-ray. Sometimes if it's severe cases, like I said, they do blood tests. That patient of mine was found to have hypothyroidism. So after starting thyroxine, it actually got better.
Okay.
Yeah. So lactulose.
So in case if it's hyperthyroidism, are there any other symptoms to it? Like
I think you meant hypo.
I don't know, hypo.
Hypo is low. Hypo is low. Low thyroid. Low thyroid causes slow bowel movement.
Okay.
In a way translates to constipation. Yeah.
Okay.
So what are the other symptoms in a child? Not easy to identify. The hair may be very, very brittle, very, very thin. Okay. The growth may not be so good. The feeding may not be so good. Yeah.
Okay.
So it's not very, very direct, not very telltale. You need investigations.
Okay. Ken, and looks like we have a lot of questions, then we don't really need to go as planned, right?
I don't know if you want to talk about other things. I don't know, I'll leave it to you.
Okay, so do we have a video for the fever or no? Do we have, no, right? Not for fever. Okay, Ken.
No.
Okay, we'll just take one more question, then we will proceed to the next topic. Okay, so Jasmine asks, if my baby's hair is not growing at all since birth, now already 7 months, is there an issue? Can I answer this? No, it's not an issue.
Jasmine, it really depends on how much hair she has now,
My baby was quite botak until 2 years old.
Yeah. My daughter has very, very few hair. It didn't really grow much until about 2 also.
Yeah.
My daughter only started, I think this end of last year, then started to get more hair. So you gotta wait a while.
Yeah. But I mean, is there any concern if with regards to hair? No.
Well, if you are worried, usually you need the doctor to take a look at the scalp. Okay, because if we do find certain observations on the scalp, it may mean certain type of hair conditions, and then that is a different situation altogether compared to the hair is fine, it's just not growing as fast as or much at all, versus a hair that has a lot of
patches,
like patches or balding or inflammation. That is a different situation.
Okay, so as long as the surface skin looks healthy, dry, I mean healthy and like normal skin, and you have the, what do you call, follicles? What do you call? Yeah. Then
follicles.
It's not an issue lah.
You may have to wait a while lah, honestly.
Yeah, I waited 2 years. So okay, so we just want to move on. Actually, what we have planned is we wanted to talk about allergies as well. But I think we covered a little earlier on with regards to eczema. So yeah, maybe Dr. Chen, you can let us know what kind of allergies. Actually, for me, I think because few years back we actually had this incident of a child. Actually, he consumed something that he was allergic to, and then it was lucky enough that a GP nearby in the shopping mall, I can't remember when, he actually sort of performed some emergency help for him. Yeah, so I think allergy in less serious cases can be just a rash, but maybe you can also talk about the more severe cases that we should also look out for.
Okay, you're referring to food allergy, right? I mean,
food allergy.
So food allergy is so this is a condition that is getting also increasingly common in our population. Strangely, allergic symptoms seems to be very common nowadays. So some of the statistics is that for infants, as high as 5 to 6% of infants may have food allergy. For children up to 4 to 5 years old, as much as 3 to 4% can have food allergies. And almost all of them are caused by this particular 7 to 8 type of food. Your nuts, right? All sorts of nuts, your peanuts, your fish, shellfish, any type of seafood with their shells, like your prawns, crabs, lobsters, clams, your soil, milk, your wheat. So these are the common types of food. Egg as well.
Yeah.
So these few groups cause actually as much as 90% of all food allergy in Singapore. Like you mentioned, the very mild ones can just be eczema, some hive.
Yeah.
Right? Your hive is like a reddish bump that is very itchy. It could be one, it could be many.
Yeah.
And then in severe cases, usually caused by the nuts and the seafood. These two notoriously causes the very severe allergies where you can have swelling of the eyes, swelling of the lips, even very severe conditions like anaphylaxis where the child potentially can be fatal.
Yeah.
Yeah, so very, very serious cases. So there are treatments. I think treatment for it is quite straightforward. If you can identify that this particular food causes this problem, then you're quite sure that this is the one that causes the problem. Okay, so but in Singapore, if we do see an allergy like that, we'll refer to the allergist in the children's hospital. Okay, because they need to be managed there. They need to be sometimes treated. Okay, some of the treatment includes immunotherapy or small amount of gradually food challenge, and they need to be given sometimes EpiPen EpiPens are like epinephrine. So in severe cases where you accidentally actually consume some of the food that you are allergic to without knowing, because nowadays the food is quite complex. Take some of them, the severe reactions happen, and you just got to jab the child with the EpiPen. So these are the stuff. Yeah.
Okay, but we normally won't have it at home if we don't expect our children to to have like allergic reactions.
Yeah, you usually don't have it, but if you have it the very first time, and it is a severe reactions, and you get referred to the hospital, and the allergist that recognizes this will, in fact, prescribe you with EpiPens, because the chance of it happening again is there.
Okay, so is it that when it first happens, it doesn't happen as strongly, or we should, I don't know, like at the first occurrence, right? Will it be life-threatening at the first occurrence? That means once exposed.
Okay. So food allergy is like a virus, right?
Okay.
So when you are first exposed to the virus, you don't have antibodies.
Yeah.
Yeah. So your body does not have antibodies to fight it. So same like a food allergy. When you first consume the food, your body doesn't have the antibody. So when you first consume the very first 1 to 2 times, right, you won't get an allergic reaction.
Oh, okay.
Yeah, it's when you consume the second time, third time, that's when the severe reactions start to appear.
Oh, okay.
Yeah, so because once the body builds the antibodies, it is the antibodies that causes the immune reaction.
Okay.
Yeah, so sometimes the parents say, oh, I gave my child egg last week, no problem.
Yeah.
This week, then the eyes got swollen.
Yeah.
It's still possible.
Oh, okay.
Yeah.
Because I think last week somebody was just asking in one of the groups that I'm in. She was saying that she actually exposed her baby to tomato twice. Then somehow this week, it caused an allergic reaction around her mouth area. So we were thinking, maybe it's the sauce of the tomato, or maybe it's like
tomato allergy is quite uncommon, though.
Yeah, is it?
Quite uncommon. Yeah.
I think just a slight reaction like on the skin area. Yeah. So
okay.
My daughter also had it
Okay, it's possible It's possible. Anything is possible.
Okay. So now I know. So it's not the first exposure that will determine whether they are allergic to that particular food or not.
Yeah, it could be the third time, fourth time. Then when the allergy starts to become more obvious.
Okay. So we have a video for allergy, right?
It's for choking, actually.
Oh, sorry. Okay. So just for choking. So I don't know if anybody has any questions about allergic reaction.
Food allergies, yeah.
Yeah. So okay. So is that why they say that to check? Okay, so there is a how should I say? There's a 3-day rule, right? To check for allergy. Which school of thought are you? Whether to
3-day rule meaning?
That means to say when you introduce a food, you have to wait for 3 days to determine if so like okay, for babies who start weaning, right? We give a single ingredient for the next 3 days.
Oh, okay.
And then
okay, from a medical point of view and from a practical point of view, 3 days is quite short.
Okay.
For a child to take to a type of food, okay, I don't know lah. For a child to take to a type of food, usually it may be more than 3 days.
Okay.
For him or her to start to want to get used to it. From my experience with my kids.
Oh no,
okay,
but
it takes about.
If let's say for allergic food allergy point of view.
3 days is valid because, like I said, the first day maybe nothing. Second day, third day, then you start to show the symptoms.
Okay.
So perhaps you want to try going to 4-5 days.
Okay.
That is also an option.
So now there are also actually 2 schools of thought. One is that you should introduce allergens only at a certain age. This is the traditional way of thinking.
Yes.
Then there's this another new thing that says you should introduce allergens as early as possible in a child's life to reduce the impact of allergy.
So for me, I come from a safety point of view because
Okay.
For doctors are generally risk adverse. We don't take risks. So if we know that these 8 types of food can cause severe allergies, then I tend to want to test them at a later age.
Okay.
Okay. For me personally, I take the 6-month point. Okay. So for the mild allergy, those food that I know causes mild allergy, not so severe one, your egg, your milk, your soil, I can test them after 6 months.
Okay.
For the nuts, the fish, okay, we could test at a later stage, like maybe
fish also?
even okay lah, your prawns, your crab stuff, maybe after 12, especially the nuts, especially the nuts and peanuts after 1 year.
Okay.
Yeah, that is from a safety point of view lah.
Okay, so the stronger ones are the more potent ones. You leave it to the end.
Yeah, the more potent it is, the later you try.
Okay.
Because allergy reaction in an infant can be very, very bad.
Okay. So yeah, I coincidentally asked the question that Yvonne wanted to ask. So Yvonne also asked like whether we should introduce food to infant as early as possible. So
correct. So there is another school of thought which that concept you may have to ask the allergists because they are more at the frontier of allergy. It's a big topic. It's way beyond me.
I think also because when at the first child you're more kiasi, then the second one I think for me I wasn't so kiasi anymore, so I went ahead with like egg yolk at like 6 months.
Fair enough actually.
Okay.
Fair enough.
Okay, can. So so on to the next topic. Okay, we don't have any questions on allergies anymore. Do you have anything to add, Dr. Chen?
Not really. I think food allergy quite straightforward.
Yeah. Okay. So and then we will move on to the topic that we wanted to discuss about choking.
Yep.
So just for like a public service announcement, I just wanted to share with our audiences like how we can manage choking behavior in children, because I think many times, right, when children gag or they choke, parents will always want to go and dig the food out. And sometimes this will actually harm the child even more, as of what I know lah. So so I just wanted to maybe share on the difference between a child gagging and a child choking, and also how we can manage it at home.
Okay. I think about that point of trying to dig out stuff, it's if you can clearly see the food object, right? If you can clearly see and it's not too backwards, then it is actually fine for you to use your little finger to try to dig it out.
Yes.
Okay. But if it's too far back, you can't reach, or the child is gagging or choking, you try to look inside, you cannot see anything. Do not blindly stick your finger in to try to remove something.
Okay.
Because you may very well push that small pea into the airway instead of bringing it out. So maybe it's about to come out, then you go and push it back in.
Okay,
it can happen. So this is something that you have to be very clear. You can see it, you're confident of taking it out, please go ahead.
Okay. So usually it's like start at the cheek, then you can actually remove.
Usually start at the cheek should not cause much problem. They should not be coughing or they should not be choking. Then in terms of choking, for me, it's very simple. I divide into choking or everything else. Okay, coughing lah. So what I'm trying to say is that when the child is choking, all right, it's very straightforward. No cries, no sound, no coughing.
Okay,
no sound
coughing
at all.
Is choking. Okay, can.
Yes, so 100% obstruction, that's choking, right? No sound, no cough, no crying. The face will be very red, it's like a lot of pressure building up. Sometimes turn purple, turn bluish purple, that's like quite late already. Or even sometimes they will just become unconscious. Okay, so that is straightforward choking. Okay, everything else, for example, like noisy breathing, very bad coughing, you observe first. Okay. Let them cough it out. Don't do anything. Okay, because it's their natural mechanism to cough things out. Let them cough. If you want to, what you can do, you can gently push them forward. Okay, and then let them cough it out. Okay. Sometimes some people even say don't even pat their back. Okay. Why? Because sometimes by patting the back, some of the food particles, right, you shake a bit, it may fall backwards. Okay. So you just already. Yeah lah, I know. Definitely, most of the time it's okay lah. There's just theoretical risk of that happening. Okay. Yeah. Okay. Then if it's truly choking, right, then it is your first aid ready for choking first aid that for infants that we can show the video for. Okay. Yeah,
so we will have a look at the video.
Yeah. Now, can everybody see this? Before I start this thing, this is again like a public announcement. So if you can Google search, you can find this KK Urgent Pediatric Advice Line. Okay, UPAL. So you Google search UPAL, all right? This thing will come out. Then at the bottom, this button you can click and then you can communicate with them. So for emergency, 8 a.m. to 11 p.m. 12 o'clock afterwards, don't type, nothing will happen. Okay. So this is a choking infant.
And then the first thing you need to do is just support your baby's head and tip them forwards. And I'm going to give them what we call back blows.
So I'll just play and then I'll explain.
With your baby in this position, gravity is on your side. You can see their head is lower than their bottom. And then with the heel of my hand,
so the first
I'm going to give them a blow between their shoulder blades. So I'll demonstrate for you now. If it's not come out, then I'm just going to try again. And keep going until it comes out. What the back blows do is they create a vibration and pressure within the airway, which will hopefully force the object out. If they've not worked and I've done 5 back blows, then there is something else that you can try. So turn your baby over, supporting their head still.
And if it's still not coming out, you turn the child around.
Still keeping them resting on your knee. And then in this position, with 2 fingers right in the centre of my baby's chest, I'm going to give them what we call chest thrusts. And it's a very quick, fast push down.
It's 5 chest thrusts.
If it's not come out, again, just keep going. What the chest thrusts do is they will hopefully squeeze the air out of their lungs and push the object out of the way.
Yeah, okay. Okay, so what I just showed was the first aid of a choking infant, less than 1 year old. So if you realize that your child, after eating something, suddenly stop making any noise and is like really in distress, red already, so you know that something is wrong and you think that it's choking. So straight away, you quickly bring the child from the baby seat and then you point the head down so that gravity can help to bring the food out. And you start first by hitting the back with the flesh of your palm. Between the shoulder blade. Don't be scared, you gotta hit hard. Downwards. Hit hard downwards 5 times. And if the particles is still not coming out, there's still no cries, no cough, no shouting, then you have to turn around and you do the 5 chest thrusts. How you find the landmark is the nipple line. So you find the nipple line with your ring finger. And then your index and your middle finger above the nipple line. At the chest bone, sternum, and you press hard down. So 5 back blow and 5 chest thrusts, and you just keep doing it until the food particle comes out, the child cries, or cough. Okay, that one is success. Of course, the other thing is that they can become unconscious, right? So when that happens, is severe already lah. So quickly put the child down, call for help, call 995, and then you proceed to CPR, infant CPR.
Okay, but do we have time to wait for them to arrive actually?
Okay, so the other thing that you can do is the moment the child is choking, straight away you call 995 first, or you call somebody. If there's somebody around you, your helper, your husband, ask them to call 995 straight away. Then you go and do your first aid.
Okay.
Right.
So it should not be a wait and see kind of thing. So once the choking happens, just call first.
From a safety point of view, yes, I will do that. I will do that, okay? But the traditional teaching is you go and do your first aid first if nobody is with you. So don't waste time calling the phone and forget about doing the first aid.
Okay, because I feel they take some time to come. So if it's like 10 minutes, if there's obstruction in the airway, can the baby wait 10 minutes?
Yeah, generally, if it's completely blocked, 3 to 5 minutes, you are in danger lah.
Yeah, lor. Okay.
Yeah. So you can just call lor. You can just call. Practical point of view, yes, just call.
Okay.
My advice is yes.
Okay. Can. So I hope that we have addressed. I think we have addressed all the questions. With regards to choking and allergy, nobody has any questions. Yeah. So is there anything you want to add?
Not really, actually.
No. Okay, sure. So I hope that we have provided a valuable session to all of you here. I mean, there are still a lot of them online, so thank you for staying on. Yeah, sure. Thanks for the people who are who are still watching us after like after about an hour. Yeah, we actually planned it for about 45 minutes. So overrun for a bit. Okay, so I think if let's say with regards to whatever that we have discussed, if you have any questions, just feel free to maybe just leave it in the comments, and then we can answer them. I can forward the questions to Dr. Chen, and then I think he'll be more than willing to answer them.
No problem.
Yeah. Okay. So thank you so much for your time. Thanks for sharing with us.
You're welcome.
Yeah, and although you are so busy, thank you for taking time off. Right.
Sure.
Okay. Yeah.
Okay. Thanks for having me.
Thank you, everyone. Thank you.
Okay. I hope it was educational enough.